When you think of your breath, do you think of your dentist or do you think of pulmonologist or maybe an allergist? When you think of your breath, what do you think of? Well, I would have thought of a pulmonologist. I would have thought of a allergist. But learning with Dr. Claire Stagg, I realized it's all connected. Yes, it's all connected. And this is what I've learned and what I value so much of Dr. Stagg, that we think of ourselves in the medical process as different parts of a body. But what I've learned is that it's all connected. I'm surprised that more dentists haven't figured this out or more doctors haven't figured this out. But today we are very blessed, very lucky that we have Dr. Claire Stagg in the classroom, one of my favorite dentists in the world, who will share how our breath is connected to our oral health as well, and what a dentist can do to make our breath better. So go get some pen and paper and start taking lots of notes because we're going to learn and grow together. And when you need a friend, you can count on me. I'll be right here waiting for you. Hi, my name is Lillian McDermott, and I am a certified life coach, a certified holistic cancer coach, and the host of The Classroom. If this is the first time that you're coming into the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening and viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. So when you think of dentistry, throw everything away that you thought of, that you're just going to go to a doctor because you have the dentist because you have a cavity, or it's your 6-month cleaning, or whatever it is that you go to a dentist, or maybe you cracked a tooth. But what if you were to go to a dentist for more than that? More prevention, more, whatever it is that you learn with Dr. Claire Stagg today and in our past classes. And by the way, she already has her own playlist on YouTube. So you can just check all the classes that we've done in the past. And just know that today we're going to be talking about our breath and how a dentist can make it better. And since it is our sole purpose in life to give and receive love and knowledge, I am so grateful that Dr. Claire Stagg is in the classroom. Welcome back to the classroom. I love holding your book. It feels so good.
It is. It's got lots of good energy.
It does. It does. So now, before we started talking, I said, save it, save it, save it. I said, I really want to get your true passion here because I understand that we wait too long to go to the dentist. So why is it, and what is your perspective as a Swiss Army knife of dentist? What is your perspective and what you need to alert us today?
Wow. Okay. So I just wanted to let you know the American Dental Association has actually had a mandate now that says that dentists are the first in line as diagnosticians that are the most capable and aware of what is going on that could help determine the root
Wow.
cause of sleep apnea.
Wow.
So what people don't understand is that it all starts here. Now that's our wheelhouse as dentists, right? The head and the neck is what we do. However, and that's what we were talking about today, is discussing structure, function, mechanics, how everything's connected to figure out how it works and how it looks when it works right. And then the other part is, okay, well, what can you look at to see when it's in dis-ease, what it is in dysfunction, and when it's not working correctly. All right. One of the things what you told me to hold it, was most of my patients, most of them are looking for help. in the sense that they've been everywhere. Dentists in general are not trained for this. I have in my book, in the sleep section, I have I have a lot of axioms everywhere, but my very own axiom is it's paradoxical to see that dentists are now waking up to the real reason why their patients are falling asleep inappropriately. So, I mean, that we are the first line in defense or of defense to determine why patients are not sleeping appropriately. Now, we cannot diagnose as dentists sleep apnea, obstructive sleep apnea, but the American Dental Association also said that we are the only ones who can treat with oral appliance therapy patients who have breathing disorders. And that's a huge, 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 huge step for us, because as much as they won't let us go in the quote unquote medical domain in their playground, in their sandbox, they were encroaching on ours. They were just handing out appliances left, right, and center without understanding the consequences of non-follow through. So we will talk about solutions and appliance therapy and options at our next talk, because those are going to be all the solutions. But today I really want to emphasize, and if your viewers or our viewers can go ahead and get a mirror, because we're going to have fun today, and we're going to look at our faces, and we're going to look at what's wrong, and we're going to look at what's right, and then we're going to figure out what we present with and say, ooh, so maybe that's why I have XYZ.
Okay. So I wish you would have told me about getting a mirror. I don't have a mirror. So let's
you can look at you in the thingy.
Yeah, I could just see me going, I don't think my listening and viewing friends, well, maybe my listening friends are okay with that, but my viewing friend, no, I don't think so. So let's talk about obviously sleep apnea. What we're going to be talking about is structural, normal, and what could go wrong. What is not normal. So that's what the purpose of today's class. And then part 2 is going to be the solution for what's not normal, so that you know. So this class will be in Dr. Claire's
2 parts.
Yeah, 2 parts.
And thank Lily, because I was going to do 3 parts. And she said, no, we should keep it to where they'll keep following everything. I said, okay, well, we'll do normal and not normal and structure and chemical and everything today. And then the solutions. And now you know me, I'm not going to be able to not talk about solutions, but still, yes. I'll try and keep it together.
Yes. And then that's my thing. I like to know about what can I do? I want to get it done as quickly as I possibly can.
Right.
But unfortunately, many of us don't even realize that there is a problem. So you've asked people to go get a mirror. I'm hoping that they're going and running to their bathroom with their phones and their whatever they're listening to right now. So what is the first thing that we all need to look at when we are trying to figure out structure versus what's normal and what's not normal?
All right. So I think we need to define airway. I think we need to define breathing, right?
Okay, let's do it.
All right. Okay. So we'll define what's normal in breathing, why we breathe. Believe it or not, some people don't know how and why we breathe and what's normal. And then we're going to divide in the signs and symptoms into what you see. That's hence the mirror. All right. That's the outside signs. Those are the objective signs. Those are the things that you could look at you, or you could look at your husband or your spouse and say, ooh, oh yeah, you have XYZ. And then I will share with you the inside ones, the part that goes like, okay, these are the things that I look at when I do my diagnostics, so that I can take the outside. It's like an orange. All right, or an avocado peel. You have the outside, but you don't really know how mushy or how sweet or how sour or how ripe or not it's going to be on the inside. And so that's where the diagnostics that we do to help me see the inside of the head and the neck will help me correlate. Remember that show Bones, to where they would reconstitute the physiognomy of the patient when they had all the bones that they would pick up from crime scenes? All right, so that's what I do backwards, in the sense that you come in and now I'm going to figure out, and And this is why it's so interesting is that already looking at you, I can tell because the signs are so obvious.
Okay.
And I just tie in, I just hear you talk because you're going to tell me exactly already what I know usually, but that's where we're going to tie in the symptoms because the symptoms are more subjective. Those are the things that you go ahead and, well, I feel tired. I don't wake up refreshed. I have to go pee every hour. My child bedwets. I'm exhausted every day. I fall asleep in front of the TV. Unfortunately, some people even fall asleep driving. That's really, really bad. I snore. My husband snores. My husband, I could get him to, and unfortunately, some spouses have to sleep in another room because the other makes so much noise. So those are the subjective parts. All right. I'm going to talk to you about the objective parts, the part that's me, that I, as a dentist, will see. And we talked earlier on, and sadly, this is not taught much in dental schools. All right. So this is something that I've had to learn through the years a lot more. It's been on my journey. And it's something that's coming, as I mentioned, we're now waking up. So we have a lot of academies, a lot of organizations that are adding sleep and all this sort of stuff to their conferences, but it's still something that a dentist will learn outside of dental school. It's not presented in school. Anything that has to do with anything that's normal or no, other than drill, fill, and bill, probably not. Yeah. All right. So you wanna start?
Yes.
All right. So let's go ahead and let's look at each other. All right. So you'll see me. All right. So when you go ahead and you look at a person, you're looking up front. And if anybody goes ahead and looks at their whole body, is your whole body straight? Are your eyes, your ears, your bite, your shoulders, your hips, is everything level?
Mm-hmm.
Now that's looking at you straight on, right? Okay. Well, a lot of times, if you're not level, it usually means that there are compensatory changes. So as you'll notice, I talked about what's good and then what's not good, right? Okay. So there's two things we need to do to survive. One is breathe and one is swallow. Breathe. You can go ahead and go months, well, maybe weeks without eating, but you can't last more than maybe 3, 5, maybe 8 minutes without oxygen.
Well, what
All right.
about
So,
drinking water? Water is very important to our
right.
existence.
That's the swallow. That's the pot. That's the
Okay,
food.
that's the
All right.
swallow. Oh,
Talking about
okay.
oxygen.
Okay.
Some people live on air. All right. But you cannot survive if you do not have oxygen. At least these humans, we are. All right.
Mm-hmm.
So what happens is you have to breathe and swallow to survive. All right. In order to thrive,
I like that 3 R's for thrive.
how you thrive is how well you breathe and swallow. Do you see the difference?
Mm-hmm.
All right. So how well you breathe and swallow will determine how well or how healthy you are. There's two things in common that you have in the two surviving and thriving. One is tongue and one is tongue space. All right. So what does the tongue do? So the tongue is attached to the lower jaw. All right. So if you go ahead and you look again, let's just come up with facial parts. Usually we have what we call, I know I'm kind of, I'll circle back. Don't worry. We're doing the front and then we'll do the side views. Okay. So if we go ahead and we think of ourselves being level again, all right. Do you want to go ahead and there's the Fibonacci rule or the golden proportion, 1.618, 1.618, 1.618. So there's certain measurements this way, and there's certain measurements this way, all right, that make us who we are, and that's where beauty comes in, all right? However, what happens is if we cannot breathe appropriately, then those measurements totally collapse and change because your body is going to compensate to be able to survive. And that's the difference between people who are beautiful, those fantastic faces that look so like, to die for, literally. And then well, that maybe not be a good way of saying it, but the faces that are so handsome and so gorgeous is because they actually have proper arches, proper development, as opposed to those who do not because they have collapsed. All right. So again, if we go ahead and we look at ourselves frontal, all right, eyes, ears, bite should be level, shoulders should be level, etc. And you want to go ahead and to see again those rules. And all this is in my book, by the way. I literally give you the measurements. I literally tell you, take a mirror, let's do this together. And it's in the beauty section. It's also in the airway section. All right. Okay. Now, where it becomes really, really, really telling is actually those, you have a lot of viewers who don't have access to visibility, right? But I want to bring to your attention Dr. Weston Price's book that's called Nutrition and Physical Healing. He was a dentist, and I think we've talked, oh, he's in my book too. We've talked about him a lot, but he talked about he was an orthodontist, couldn't figure out why all his patients had crowding, which is another sign of crowding, where the orthodontist says we have to take teeth out to make more room. That, for those of you who don't have a means of seeing, is like the big question mark. My hands are up in the air, like, really? Okay. All right. So it's like trying to park the car in the garage, but you make the garage smaller and smaller and smaller, and then you wonder why you can't fit the little bicycle in. All right, so let's go ahead and let's get back to the Weston Price. Basically couldn't figure out why the people that he was treating had less and less room, less and less tongue space, less and less airway. Now, the biggest thing that you can go ahead and understand is that if you again are looking at you straight on, all right, what's this? The nose, right?
Mm-hmm.
All right. What's the nose on top of? The roof of the mouth.
Oh, the
all right.
mouth. Okay.
Okay. Now, where does the tongue sit at rest? I want you to do an exercise right now. You could take a sip of water, or you can just go ahead and swallow saliva. Swallow. Where is your tongue? Think about it. Where is your tongue at rest?
Oh, at rest? Well, when I swallow, it goes to the roof of my mouth.
All right. So in theory, your tongue should be in the roof of your mouth all the way back, from the tip of the back of the incisors all the way back. That is a position of rest. When you're nursing, the child suckles, and that has that waveform movement, that what we call peristaltic motion, and it goes ahead and it brings the milk back, but it pushes on that premaxilla area. That suture is not yet fused, and it goes ahead and pushes. Well, actually, it fuses in utero, but what happens is you go ahead and you push, and that develops the arch. That helps with the airway, because now we grow large nasal passages, right? So again, looking from the outside in, if you go ahead and you look at a patient that has a crooked nose, or a nose that deviates off to the side, or if you put your mirror up, all right, and you look at what we call the nares, these are the ala of the nose. Are they uniform? Is one side bigger than the other? Is one side tighter than the other? All right. If you put the mirror under your nose and you breathe out, are both sides the same? All right. Okay, you could very well have nasal valve collapse, or you could have a very restricted nasal passage. And remember, the nose is supposed to be the beginning of the funnel. So if you have nice big passageways right here, like this, Lily, bringing it in like this, and this is the front of the nose, and it goes back, further back. And it's inside the nose that we have the turbinates and the concha, and that's what warms up the air. And the sinuses release the nitric oxide. So let's tie that back in with the mouth. People who don't breathe through their noses, all right, are going to be mouth breathers. Therefore, the tongue doesn't go up to the roof of your mouth. And then now, let's go to the side view. These are the patients that are going to be forward head posture. Does that make sense? So again, because they can't breathe appropriately, they're going to emphasize being able to get air in, and that is by holding their head forward. That's what we call, in our terminology, forward head posture. Let's tie that in with the chiropractors. So that's where we have the forward head posture. Fred here will have like a reverse curve. I'm sorry if I'm making everybody dizzy. Fred will have a reverse curve in his neck. All right. He'll have a forward head posture so that he can open up his airway. All right. And the roof of his mouth is going to be very, very narrow. So let's go ahead and let's talk about other signs. If you go ahead and you have, and I use this analogy a lot, if you go ahead and you consider, all right, that the upper arch, the maxilla, is the shoe box, the lower arch is the shoe, and the tongue. Always remember the tongue. Tongue, very, very important. If you go ahead, you have the upper arch is the shoe box, the lower arch is the shoe, the tongue being the foot. You need to have room for the foot, right? So let's say we're supposed to be born with a size 10 shoe box. All right? Okay. Unfortunately, you have allergies, be they environmental, be they food, be they whatever they are. What'll happen is you have a retraction, a very narrowing. Basically the palate cannot be nice and broad. And one of my professors used to say the palate, the arch of an ashtray. Broad, right? The one that comes to mind is I think of those nice oyster, those big abalone shells. All right, nice big broad. All right, that's what you want. You want something big. All right. Okay, so if you don't have that and the tongue cannot fit, where is it going to go? It's going to go back. All right, so now we have the whole collapse of the system. Again, thrive, survive, which one are you doing? So now, simply by not being able to breathe through the nose, we'll have that entire collapse of all the other things that are going to occur, which is what Dr. Price showed in his book, is that these indigenous people had healthy mouths, healthy diets, healthy environments, until they went to the village where the white man at the time had white sugar, white flour, processed foods. So back in the early 1900s, there weren't that many processed foods yet per se, but the inflammation or the inflammatory markers started. That's where diet is so important. And these patients started to compensate and therefore became mouth breathers as opposed to nasal breathers. All right. Okay, so let's go back and let's start looking at inside the mouth. Everybody still has their mirror? Okay.
I hope
All
so.
right. Okay. So
can I
let's
ask you a question before you go forward?
Yes,
Okay.
go for it.
So
interrupt whenever you want.
Perfect, because you're talking about the structure of the mouth and how it develops the way it does. We live in a society, and when I was born, my mom was not encouraged to nurse us, breastfeed us. We were bottle fed children.
I was
Later,
too.
yes, and later on in life, as I was being a mom, they were encouraging breastfeeding, and
You can
some of my
thank
friends.
You can thank Dr. Spock for that.
Yes. And so when it comes to that, how important is breastfeeding your child when it comes to the suckling and the structural of the mouth? Because a lot, also what I've noticed is that a lot of kids are eating a lot of soft foods like pasta and sandwiches, and so it's processed, so it's not very hard.
Let's before you go further, because there's so much in that one.
Okay.
All right. First thing, breast is best.
Breast is best.
All right. Breast is best. One, it's better because you have all the immunoglobulins, you have that cholesterol, you have everything, the full milk, everything that you have. That's pure brain food. That is like major development of the brain, right? Everything that the child should need immunologically, everything you want is in the breast milk. So even if you can't, for whatever reason, do more than 6 weeks, do at least the 6 weeks. Plus, on top of that, you're going to develop the arches. All right. Second, formula is never going to replace the breast milk. It cannot. It's not a God-given formulation. It's not. I mean, it's like they went out in the forest, decided they were going to take one element of one herb and patent it so they can charge you money for it. I'm
Yeah.
sorry, am I getting
No,
in trouble
no,
here?
no, 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 you're not. And I want to
But
add to that, they also put soy isolate, which is a very destructive,
all right. So
okay.
all the different chemicals in there. And then you have people, any seed oil or anything. So now you have all the seeds, you have all the chemicals. So breast is best.
Okay.
The next thing, so okay, so breast is best chemically. So let's go back to our connections. Breast is best chemically. Breast is best structurally, functionally, because you're actually going to have that peristaltic motion I was telling you about. And it's emotionally because you're going to bond with that child. That child needs to hear that heartbeat because it still has that relationship with the mother that it had in the womb. It still continues during that time. All right. That's why hopefully some women are able to have some pregnancy, pregnancy time. And it also helps the mother transition from the hormone pregnancies to the natural, hormonal post giving birth things, right? That's very technical and medical there for you, but you understand what I'm trying to say, right?
I
Okay,
do. I
so
do.
it's best chemically, mechanically, functionally. The first thing. The second thing is that what irks me to no end is the fact that they give the pacifiers to the children, the packet that they give the parents, the mothers in the hospitals. All right, they give them this pacifier. No pacifier is going to replace the mother's breast. I don't care what nipple shape, size, form you make it, never. My children, I made it a point to never give them a pacifier. They never suck their thumb or digits. They never pacified with anything. And I nursed as much as I could. Now that was hard. Trust me, as a dentist, trying to nurse, I pumped and I pumped. And then that's when, we froze the milk or we had it in the fridge and my husband would give it to them during the day. And when I got home, I nursed. All right. So that was that. Not everybody can do that, and it's okay. I've had staff here to where they had their babies and then they would pump and then they put it in the freezer and then they would take it
But
home and
then
then
you're
their
giving
husbands.
the child the bottle. So which bottle,
Yeah, but
nipple
that's
is
after
best?
but that's after they've been at home after birth. All
No, no,
right.
no, but I'm
But
just saying, do you have a suggestion of what nipple is best if you're
that
going to pump
my
and
my eldest is 26 years old. I have no idea what's out there now. All I can say is do the research, and you may have certain things that may work for one that may not work for the other.
Okay.
A lot of children have been misdiagnosed with GERD and sleep apnea or digestive issues simply because of the position that the babies were put in, as well as the nipple shape, as well as the flow velocity. Just
Mm-hmm.
be aware of that.
Okay.
Okay.
That's
All
good.
right. So that's a lot of stuff for moms. If there's guys out there, let's get back to you. You might have a wife who's pregnant or who may be having a baby or who has had a baby. Let's get back to the shape of the palate, the shape of the arch. Remember, we talked about the box, the shoe, and the tongue. All right. Okay, let's look at the tongue. All right, let's see the tongue. Does it have scalloping? On the sides of the tongue, do you see like the little half moons along the side of the tongue? All right, all the way along the side. Usually that could mean that you have too much pressure buildup, and that's the imprint of the teeth along the sides of the tongue, and it sits low in the mouth. So that's already three things: pressure, imprint, position. Chinese medicine, here's a fourth one. Chinese medicine will tell you tons of different things. So you can diagnose 250 diseases with just tongue. Just saying. All right. Okay. So now we went on to that. Remember too, very important. Remember too, we talked about the tongue being at the roof of the mouth. Okay. Roof of the mouth at rest. If the tongue is too low, what's going to happen? You're not going to be able to breathe properly sitting up, it's already too far back. Laying down, it's going to totally collapse. All right. So I have here my handy dandy picture. All right. To where you could actually see obstructive sleep apnea. I don't know if it's backwards for you, but this is how we're supposed to breathe, is through the nose. But unfortunately, a lot of people breathe through their mouths. And think of it this way. That still happens, unfortunately. If you're sitting up, notice how that jaw is what we call retruded or backwards. All right. Well, think of again, forward head posture. All right. You'll also have, if you're looking at yourself from the side, which we didn't do too much of, you have what we call a class 1 occlusion, to where normal is like this. Class 2 is the Bucky. Well, I can't do it because I'm not class 2, but Bucky Beaver look, right? And the big fat chins, or what we call mandibular panis. Well, Bucky Beaver would be like this. So it's more the beaver. Think of the beaver with his two big front teeth out there and the lower jaw's back. And then you have the Habsburg look, which is the class 3, like this, like all your pugs. All right. Okay. Now, all these people have a tongue issue because the tongue isn't in the right place. So the big question is, I mean, there's so much there to talk about. We already talked about the arches. We talked about tongue position. And now, unfortunately, and I have to bring this up here, and I might get in trouble for it, but it's really important to understand that there are solutions that are being given to people about implants to electrocute, no other word, the tongue, to jerk it when the patients have apneic events. I'm not going to mention a name of any companies, all right? But please do your research that if you go ahead and you have a shot, it's like literally having a pacemaker put in, that every time your tongue goes back, which is going to happen 2,500 times a day because you do it during the day, all right, and you're not breathing through your nose. So they're treating a symptom with an electrical shock. It doesn't make sense to me. The other thing too is that the patients who are supposed to be recommended this too are supposed to be those that have mild to moderate sleep apnea, but yet you have very large or overweight people that have severe sleep apnea that are being told that they could be a candidate for it. And that's something that I highly am not going to say anything more. I just think that please do your research, educate yourselves, understand what I'm trying to say is that the tongue's position needs to be in the roof of your mouth at rest. All right. So
okay, so but their doctors, this is a solution that they're proposing that you're saying is not a good solution. That there is a
I am a
structural
dentist.
problem. There's a structural problem in the mouth, and by electrocuting your tongue and making it thrust forward, it's not going to solve the problem.
So there's more than just a structural, there's a chemical aspect because 9 times out of 10, these patients could be overweight. They could have an issue to where their tongue is not positioned properly because they have no arch. So they have an arch this big. So their palate is like super. Let me try and do it to where like this narrow.
Mm-hmm.
Hold on. My handy dandy Fred, my other Fred. This is the part. This is the part that, and those of you who don't have things, this is the part that everybody doesn't get. Literally, I'm superimposing the maxilla on my face right now. Notice where my nose is? All right. What's that? That's your palate.
Mm-hmm.
So if your tongue can't fit in here, all right, notice I can barely get 2 fingers in here. You should be able to put a cotton roll across, which is anywhere from 38 to 40 millimeters. That's a quick dental sign that we can straight away see it. All right. So if you go ahead and you have this and you have this, so let's go ahead and let's put it together, tie it in together for you like this. All right. It's a little bit crooked, but if you go ahead and this is the lower jaw, tie this back into function now. Most airway patients are going to have a joint disorder too, a TMJ disorder. So a lot of times, why do they, okay, chicken and the egg, why do they clench? Why do they grind? Right? So remember, a lot of times kids are given tubes because what they're doing is they're trying to balance out the pressure in their ears because they have all that fluid because of the position that they're in. They have more fluid than they should. They're draining the tube, the air passageway gets clogged up from the other side. Bacteria come in, and so their solution is to go ahead and to put a hole in there. But in reality, more than likely, allergy, diet, environment, as well as arch development could have been a solution for that child.
Amazing. Amazing. So keep going. You're talking about
All right.
now other solutions for
Okay,
this
so
issue.
okay. All right, so let's go ahead and let's look at this. So this is me. So for example, notice how you can literally see the outlines of the teeth individually on there. If you lift your lips up, you can see how you have the roots. That's normal. You can feel them with your finger. You have patients that walk in and they have shelves of bone. What the heck, right? Those are called exostoses or an exostosis if it's only on one side. It comes from the word ex, which is outside, osteo, which is bone, right? So there's a formation of bone on the outside, which is a reactive growth process in reaction to forces that are not there normally. So on the outside, they're called exostoses. On the inside, on the bottom, they're called mandibularis tori or torus, singular, tori for plural. And on the upper, they're called palatinus tori, so or torus. So a torus on the inside and exostoses on the outside. Those are not normal. People would say, some dentists will tell you, some people have them, some people don't. Well, dude, if you have them, it's because that's not normal. Why do you have them? So you sleuth it out, right? You figure out what is it that causes these extra both processes. It's a reaction because you have extra forces that are not there normally. What are you compensating for? And every single time that you have an issue, 99% of the times that you have dis-ease or dysfunction, it's a reactive process to something that is not functioning properly. So you're coming through the birth canal, all right? You come in normally. What makes us different is animals, they come snouting, we come in at a different angle. All right. But that deforms the cranium. The cranium, the sutures are not fused. That's another fallacy again. The dental fields, they're told that sutures fuse at 9. They do not. They stop moving after you die because that's what we call the craniosacral rhythm. The breath of life is the actual movement of the sutures in your cranium that actually promotes the cranial the fluid going from your head all the way down to your sacrum and back up about 15 times a minute. All right. So that is important to know. If you have a patient that looks lopsided, one eye again higher than the other, one side bend or a torsion or any and everything that you can think of, and I'll bring the rest of my skull. All right. This is what is so important, and I'll go back to this part. I have to put him back together now, my other threads. So now what you have, if you look at this,
you're gonna have to bring thread number 3 up. There we go.
Okay, yeah. So if you want this, wait, I have to put it together to where you can understand.
And while you're doing that, let's just take one. Okay, got it. Okay.
Yeah. Okay. So now this is us with a bite. This is what us dentists see, right? But in theory, remember what I put together, the green and the white? That's all dentists look at. And they don't look at further than the second molars because they recommend you take the third molars out, right?
Yes.
Right? Right?
Yes.
Okay. Well, look at what we work with, us docs who are aware of this whole thing. Now, when you remember how this fits, all right, these forces go directly to the cranium. It's upside down and backwards, all right? Well, guess what this bone is? This is called the sphenoid. The sphenoid is the base of the cranium. This is called the occiput. That's the back of the cranium. That's where that hole is where all the, oh, sorry, this is the occiput, sorry. I was showing the frontalis, I was asked backwards. So this is the hole where the brainstem comes out, all right? This is the atlas orthogonus. Anytime you have a problem in lack of vertical, you're going to have headaches in the frontalis and issues back here in the occiput. That's the issues with the back of the neck. We can change so much with the body by changing the bite. All right. So
Wow.
to get back with the, let's finish the cranial strains and everything. Then we'll talk about teeth afterwards.
Okay.
When you go ahead and you have this changed, the sphenoid, this part, we could actually break sometimes these off when we're taking wisdom teeth out by mistake, not on purpose. These are the pterygoid plates. We have muscles that attach to them, the elevator muscles, the ones that do lateral excursions, the ones that when you clench, right? Right, Lily? The ones when you clench that hurt?
Yeah.
Ouch.
Yep.
All right. They also attach in the cranium. Basically, any and everything you do with your bite or your head or your neck is all connected. You can't take or separate any of the others. And interestingly, the tongue is attached down here. The genioglossus attaches right here in a little tubercle right here, which also attaches to a bone. Can you see that little bone called the hyoid bone?
Yes.
So every single time you move your neck, all my books are in the way. Every single time you move your bite, can you see?
Yes.
See how it moves? Your whole neck, everything moves. So it's all connected. You can't change it. And that's when you have forward head posture because of your bite, because of your tongue malposition. You don't have air. You don't have air. You have malposture. You have malposition. Chicken and the egg.
And
Chicken
if you were
and the
to
egg.
look at changing the posture, which is what we're going to be talking about next time, how do you fix this anomaly or what we think is normal? I mean, this is the way we were created, regardless of what our social economic background is. You know, we are who we are. So you go through life with knowing this is your body, this is your mouth, but then something like sleep apnea happens. So when it comes to that, what I'm hearing you say is that you can be pumped in your airway, but if you don't solve the problem, it's not going to be optimal for your
Addressed.
health, right?
You're just putting a Band-Aid on a gangrene toenail.
I get it. I get it. So I'm looking forward to hearing about all these suggestions. I really am.
Right. So let's finish teeth. So you're back in there. So you have all these extra bone growths, right? Okay. Then afterwards, that's looking at you. Now let's look at the teeth themselves. Are they worn? Are they chipped? Are they flat? Are they still, with little mamelons, which means that you have an open bite? Do you have one side that's touching and then not the other? That's called a cross bite. All this is in my book, by the way. Every single thing that I'm talking about is categorically listed and explained with pictures and diagrams. In Smile, it's all connected, whole health through balance, because you can't disconnect any part. So again, different things to view would be how the teeth come together, how much vertical you have, which is height, how much transverse width you have, and are your midlines lined up, or your midlines are like cat and Wonka? All right. Look at the gum line. Do you have a lot of notches at the gum line? Those are called abfractions. It's like if you hit the demolition ball to a wall over and over and over, do you think the wall will crack? Same thing. That's where people can end up with fractured teeth, with crowns that keep coming off, with fillings that keep breaking. So insanity is doing the same thing over and over and expecting different results. You have patients who will end up having fractured teeth or teeth that hurt, and it's like, okay, well, let's do a root canal. Okay, well, that didn't work, so then let's do a crown. Well, that didn't work, it failed, so let's take the tooth out, and then let's do a bridge, or let's do an implant. Well, that didn't work, so let's go ahead and on and on and on. And in reality, it's like, well, wait a minute. What was the root cause? No pun intended, but yeah. But what was the cause? Why did that person have a failure in the first place? It's like if you have a bicycle and you're going down the road, right? You just don't tell the person who has the bicycle, let's throw the bicycle away because you keep getting a flat tire. Like, why do you keep going down the road that has glass in it? Or why don't you fix that chain so that the tire can move smoothly? Try to say that 3 times in a row. All right. What is it that you need to do to function appropriately? All right. So we talked about sort of outside going in, right? All right. And look at the ears. Are the ears away? So I'm going to exaggerate my lovely ears. So are they out this way? Those are the patients who have temporal or parietal bone distortions. Again, back to the cranium. All right. If you have one eye higher than the other, one orbit higher than the other. I didn't sleep much last night. I have 2 kittens and a dog that decided to have it at each other. All right. But if you have a lot of what we call venous pooling, where you have a lot of circles under the eyes, then you'll have a lot of lymphatic drainage issues. All right. Allergies, for example. Let's say somebody's clearing the throat a lot. That would be the sinus drainage. Again, fluid. Massive tonsils in the back of your mouth. All right. So now again, we could have grade 1. They're in the corner of your mouth. You could have grade 2. You could have grade 3, and then you grade 4 when they're kissing tonsils. You can't breathe through that, and that's scary when you think that people are being put on a CPAP because they have severe sleep apnea, but there's no hole to go through. Are you breathing through a coffee stirrer, or are you breathing through a big fire engine hose? All right. Okay. There was another one I wanted to come up with and I thought of that we don't talk about. The soft palate. Go ahead.
So let's take a little break. And I know I know that we only have like maybe like 5 or so minutes left in the classroom, but I wanted to take a moment to thank Dr. Stagg for being a sponsor and inviting you to listen to her classes that we've done. We've got a playlist for Dr. Stagg in YouTube, but you can also go to whenyounneedafriend.com and you can find her there and listen to what she's talking about from the beginning all the way to what we're building up so that we understand the body. So go to whenyounneedafriend.com. Please subscribe, like, and follow me on all social media. Understand that there is there's so much we don't know. So let's educate ourselves. This is the first time I hear about all this stuff when it comes to sleep apnea. And we know about the tonsils coming together and then all of a sudden, they remove them, and those are not solutions. And I'm looking forward to our next class because there's so much we don't know. So I want to encourage you to please like and follow me on all social media. Please support our sponsors the way that they're supporting the classroom. Then you can go to my Shop Now bag. There's so many wonderful things that you can look at, you can purchase, and it'll help the classroom grow. And then lastly, you can become an enrolled student in the classroom, whether it's your time, your talent, your treasure, whatever you can give, whether it's a one-time donation or a recurring donation, all of it. Sharing this video with someone you love that may have just been diagnosed with sleep apnea. That's a way that you can help the classroom grow. Asking questions, emojis, any questions that you ask, I always send them to Dr. Claire. I ask her to respond to them, and she does. So I want to encourage you to give generously. We're coming to the end of the year. If you're looking to donate, please do so. We could use everything that you have to give. Today we have Dr. Claire Stagg in the classroom. This is part 1 of 2. So we're going to be talking about the breath, what's normal, what's not normal. She's done a phenomenal job getting us there. So thank you, Dr. Claire. If you want, Dr. Stagg, if you want to reach out to her, you can go to healthconnectionsdentistry.com. You can call to make an appointment at 321-777-2797. And anyone who has that many sevens in their phone has to be good because it's divine. And so thank you so much, Dr. Stagg, for coming into the classroom and sharing this. This is incredible information that you don't hear anywhere. So continue with the tonsils because I don't want to, we just have 5 minutes left before we go.
That was just the tip of the iceberg.
Well, maybe we need 3, but let's.
I told you.
I know, but
it
they
took
can
me
always
10
get your
years.
book. They'll always get your book. Okay.
It took me 10 years to put together in a very condensed version all this information into Smile. Can you imagine trying to talk about this in an hour?
No,
Less.
you
It's
can't.
hard.
And by the way, you can get the book in Amazon. You can click on her name, and if you go to the blog, you just click on it, and it'll take you to Amazon where you can get a copy of your book. So now, what were you going to talk about?
You know what I would like you to do too, Lily? Because many people have purchased the book, but they think that it's an overwhelming amount of information. They think they have to read the whole thing before they can post a review. If they can write a review, they can always edit it when they realize how much more awesomer it is. But if they could write a review so that other people can know that there is hope, that I think the most important thing to give people is hope, and knowledge is power. So if they understand that they're not alone in what's going on and there is somebody that understands, and my goal is to help change the demand. So if people understand what's going on with their lives, with their bodies, with their health, then they're going to go ahead and look for doctors who can help them resolve these issues. So my other goal is to go ahead and help doctors understand, okay, well, these are the signs and symptoms. These are the things that we can do to help them. So basically, in effect, Smile, this book is a bridge over. It's like a bookend. You got the layperson on one side, you got the professional on the other. And this is the information. It's not a pedantic textbook. It has 356 references, but it's all written from a mom to other moms. It's a professional to other professionals. It's a layperson to another layperson. It's the same conversation type of talking that I would do in my chair back to front, because the last thing I want is that deer in the headlight looks. I have no idea what you said. I'm overwhelmed. I know you're overwhelmed because I have a whole life work to share with you that nobody's told you before. So you said, and you said, keep it for now. Most of my patients have one foot in the grave, the other in a banana peel. It's like one skid and then they're done for. It's like, okay, they've been round the block, round the block, round the block. Why hasn't I been told this before? Why didn't my doctor tell me this? Why didn't my dentist tell me that? Why didn't this? Why didn't that? Why didn't this? Why didn't that? Well, get Smile. Get the book, understand, and then be empowered to know that you have the means to get the knowledge to pursue what you need to do. And next time, so we talked about all the things that could go wrong. Next time, we're going to talk about all the options, because there's so many of them. There's so many different options that we can do to help patients get well. You all have to decide what it is that you want and how far down the rabbit hole you want to extricate yourself from.
Well,
but you got to know the rabbit hole, right?
Yeah, but here's the thing. You have people listening going, oh, this is already overwhelming. But they're going to be facing these things if they don't listen and prepare themselves of what their options are. They might make the wrong choice for them.
Can I share something with you?
Sure.
And I think this is very, 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 very important. A lot of people are going to say it's overwhelming because we talk about 6 million different scenarios. Whereas when you walk in, you are one person. and you have one or two or three or four or five symptoms, but my gift is I connect the dots. So then I look at
It
you and
is
I say,
true.
okay, you have these issues. What do you want to do with your mouth or your health for the rest of your life?
Yes, yes.
It's
And
that simple.
And the thing is that you can come to Florida. Who doesn't want to come to Florida if you don't live in Florida? But if you already live in Florida, we're lucky to have Dr. Claire Stagg in Indian Harbor Beach, Indian Harbor
Indian
Beach.
Harbor Beach.
Yes, but it's so close. In Atlantic, Cape Canaveral, Cocoa Beach, we're all so connected. But if you in 1 minute, if you have something to say to someone who's feeling like they are about to make a decision about maybe that tongue thing that you were talking about that causes them to be electrocuted somewhat, like a pacemaker.
Shocked, yeah.
Yeah, shock. What is your advice to someone who knows that there's something going on in their mouth, but yet their doctor doesn't, even their dentist doesn't know? How can they
But you
find
see,
someone like you
but
closer?
that's the thing, is they don't know that something is going on in their mouth
Yes.
because everybody else is looking outside. They're looking inside their sandbox.
Yeah.
Everybody's playing inside the sandbox. Smile, this book has opened up the playground. I've taken down the barriers. There's no more sandbox. It's a free for all for everybody. Empower yourselves to educate yourself. Google anything that you didn't understand today. It's a verb now. Google it. Ask questions. All right.
Well,
Go
yeah,
find
I would
out.
say before they Google it, because they're going to get misinformation too. So I would
Right.
say ask the question. There's all of Dr. Stagg's information is in the description below. It's right behind me as well. You can ask Dr. Stagg, you can ask
Well,
a
get
question
the book.
there and
Get the book.
get the book or get the book.
First of
But
all, get the book. Because
okay.
I'm going to ask you if you got the book and I'll tell you which page to go to because every and anything you'd want to know is going to be in there.
And it's a lot cheaper than a consultation, right? So, but
Well, I
there's
mean,
it is. It's cheaper than a
right,
consultation. If money is an object, if money is a problem, then you have taken the time to help them so that they can
right.
go somewhere else. So get the book and bring it to their dentist and educate your dentist as well. Dr. Stagg, it's always so fun. I learned so much when you're in the classroom. And I'm looking forward to going into getting the mirror, although I've seen my teeth a bajillion times at your clinic.
Right. Bring a mirror next time too, okay?
I will. And all of you as well. And I want to thank you, Dr. Stagg, for how wonderful you are and for educating us the way you do. And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Claire Stagg wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job.
God bless,
good job.
Lily. You do amazing work. Keep it up.
Oh, thank you. You too.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.